Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on, Naples? Dr. Chris here. I want to have a talk about hip pain with golf. So this is going to be a solo podcast. Should be a pretty short one because this is a pretty specific thing. And it's something, honestly, I see very often. So hip pain, and I'm talking about the lead hip when golfing. Why does this occur? All right, so golf is a very rotational sport, as you know. You stand with your feet planted, facing one direction, and then you have to turn your body about 90 degrees to the left if you're a right-hand golfer. So that means you need 90 degrees of range of motion from the body, and you're going to get primarily most of that, well, about half of that from your spine, and the other half from your hip. Your ankle turns a little bit, knee a little bit, but mostly, you could roughly say 45 degrees is required from the hip and spine. Now, as we age, things get arthritic. Even if there's mild arthritis, it's going to limit your range of motion, or reduce your range of motion, I should say. You could have some muscular tightness. You could have some capsular tightness. So a capsule is a sort of a sac that goes around all of our joints. The hip is a very big, robust joint with a big, thick capsule that has a tendency to get stiff. So if anything is depleting that range of motion, it's something's going to compensate. The body in sports is, focused on the function of getting the swing through. So some sort of compensatory strategy will occur. And usually that is a sort of lateral hip slide. So just picture you're kind of dipping your lead hip to the left as you come through on the swing. And so you tend to get this sort of point tenderness on the outside of the hip from that motion. So that's kind of a sensitive area. You have your glutes that turn into your IT band. I'm sure you've heard of the IT band. It's kind of this big, it's kind of like a tendon, but it's its own thing. It's a big, leathery, tough thing. I've actually, on a cadaver, tried to poke through a IT band with a scalpel, and I couldn't even get through it. That's how dense this fiber is. So there's an IT band. Underneath the IT band is a bursa, and underneath that is basically your pelvis. So if you're constantly taking your pelvis and pushing it into the bursa, into that dense IT band, that bursa is going to get irritated. So bursa are they're little sacs with full of fluid. They're all over your body, kind of like buffers. They're meant to allow things to sort of roll and slide over each other. But if they get chronic, repetitive compression, they get inflamed and then you get a bursitis. So that is probably the most likely culprit of the pain is the bursitis. So that's the symptom, but the dysfunction really comes from a compensation, which comes from a lack of range of motion, either your spine or your hip, and most often I see it in the hip. So specifically lead hip, so if you're a right-hand golfer, left hip internal rotation. All right, this might be a little difficult to describe on a podcast. I will actually link a blog, a blog I wrote on this with suggestions for exercises and how to sort of self-test it, but I'll see if I can walk you through it right now. So if you're seated, basically take your left foot, your left ankle, sit somewhere where your legs can be dangling like a table or something like that, and then kick your left leg out while keeping your knee bent at 90. So picture like the way someone would shave the back of their calf. That's kind of the motion you'd be going into for hip internal rotation. All right, that's what you need. You need 45 degrees of that particular motion. And you kind of self-measure this. It just so happens that if you take your index finger and middle finger and spread them apart as much as you can, that generally will form about a 45-degree angle. So you can take if we're doing your left hip, take your index finger, point it straight down to the floor, and then move your left leg out to the side, leftward, and then take your middle finger and line that with your shin. If that forms a 45, then you're good with your spine. But if it's a lot less than that, then there's definitely stretches and capsular mobility exercises that you can do to address that. So again, I will put a blog with pictures of actually my buddy Justin Ahasik. He's a golf pro here in town at Synergy Golf. I've got pictures of him doing some of these exercises, and it should be helpful. If you feel like you need some more help, give me a call, 239-919-7139. I do 15-minute injury screenings. It only costs $10 to come in. Just give me a call, and we can set that up. All right? Thanks, and we'll talk next week. Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get results in 2 to 5 days, no physician referral needed. Use the code DPT20 for 20% off. Go to letsgetchecked.com and use the code DPT20. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.